happy to be here tonight. We are expecting a wonderful, wonderful veterinarian, but sometimes technology and things happen where we're doing things like this that it makes it a little awkward when we're trying to find out what's going on behind the scenes. So tonight our guest was going to be Dr. Margot Roman, and she's out of Massachusetts. So there's a bit of a time change and some things going on. And she's very, very busy. So we'll just keep our fingers crossed and hope that she's going to come on. In the meantime, I am going to talk to you guys a little bit about the event that we're putting together. I'm sure you're getting tired of me blasting all this information all over our Facebook page and our YouTube channels and everywhere that you can contact us. But it's because I am on a mission. I mean, there's no other way for me to say it except that I am on a mission to stop this decline in our pets' health. And so I finally got together with Lori, who's behind the scenes right now. She's the one that helps me do all this fabulous stuff she helps me do, to get together and have you guys be able to come and sit down. A lot of people haven't done that since COVID started. We think our timing is really good because this event is going to be on October 1st, 2022 at the Hyatt in Newport Beach, California. And it's something that I've been putting together for about 4 years. And Dr. Roman is here.
Yay. I don't know if I'm on.
Hi.
Hang on. Or I can't. I don't know whether, you know, I've not used this platform before, so I'm.
Well, you look fabulous.
Well, okay, you can actually see me. Okay, so
I could see you. You had this beautiful angel glow over your head there for a second.
I got to get rid of the.
It looks
light. Okay.
I don't know. It looked really cool, actually. I kind of liked it like that. How are you?
Oh, good. Sorry, I'm late. I actually forgot. And then I realized about 1 minute till that I better put some lipstick on and run downstairs.
No. It's all good. I just appreciate that you are, you know, and all of the people that come on. We just appreciate that you guys are so passionate about changing. I was just talking about how desperate and the mission that I'm on to change the course that these animals' lives are on. And I'm so thankful that I have found so many just fabulous veterinarians like yourself that are on a mission to do it. And you guys actually have, so I have the voice and I want to talk and I want to tell the world, but you guys actually have the skills and the tools in order to do it. So I couldn't do it without you. So I just am so thankful. I don't care if you showed up 30 minutes late.
Oh, you're very sweet. It's really sweet, Carrie. And I, you know, it is the questions that you're asking is, why is this all happening? Why are we having so many animals, you know, suffering and causing so much loss of life? And it costs to both the owner and the animal, because it's not right. There's something really wrong in the way that we treat health and how we navigate through the animals' lives. And I find it really, really troubling.
Yeah.
And after being as a veterinarian for, you know, over 45 years, it's worse. It's so bad right now. And, you know, I cry. I mean, I just had a client who lost their 7-year-old golden doodle, you know, and he was only 7 years old, to hemangiosarcoma of the heart. And she tried everything. She kept this dog so healthy when she got it, but it came with such loss and its body. It was neutered at 9 or 10 weeks of age and had multiple vaccines. And, you know, she took it from that point and did all holistic, and she still got cancer at 7 years of age and had to put the dog down. And I'm still really traumatized by this past weekend's that diagnosis from that dog. And it's like, I tried everything. I tried doing all this stuff, but maybe it would have died at 3, and she got 4 more years from this dog. And that's sort of what I had to sort of, you know, give her the condolence on, is just saying, you know, what you did for this dog gave it the 7 years instead of 2 or 3 years when it came down with cancer. Yeah. But it's wrong that a 7-year-old dog in their prime is getting something so damaging like a hemangiosarcoma of the heart muscle in the atrium. It's like that. It's crazy.
Yeah. So, it's definitely, hi Lily. It is definitely getting worse. There was a point, and I don't know your experience. Mine has been, there was this brief moment. I don't know when it was. I want to say it was in like 2010, 11. I started feeling like we were getting it, like something was going to change. Like I started noticing people talking about we shouldn't be feeding kibble, and I had been fighting that for a while, and so I started feeling this like, okay, we're on, it's happening, we're going to do this. And then now, but recently I feel like we're taking steps backwards, and we're going backwards in the flea and tick stuff. It's like the drug companies started fighting harder. They started fighting harder.
They are so determined to have every dog on these flea and tick products. And I'll give you guys a case that was just clearly, if we don't pay attention to these flea and tick products, we are not very bright. I'll tell you. I had a dog that had diarrhea for 9 months.
Oh my God.
6 to 8 times during the day, 5 times at night. They went to initially they came off the plane at 6 months of age with diarrhea. So they took it to their local vet. They had all the metronidazole and the testing for Giardia and the Panicure and all the things in Cerenia and all the stuff that it was going through. 2 rounds of that, nothing happened, right? Then they went to the referral hospital and had 5 different doctors, including 2 staff doctors, doing this dog, same thing, 6 times, 8 times a day, 5 times at night. The people were exhausted. They couldn't go to sleep at night. One of them had to stay up every hour and take the dog out. They were delirious, right? So she happens to be a very educated pharmacologist and has her own biotech company. And she basically said, I want a fecal transplant. She knew about fecal transplants. She wanted a fecal transplant. And she asked this large hospital, which they asked me not to mention their name, and I feel like I should because they are well known and somebody who I respect tremendously. So they gave the dog 2 fecal transplants. It barely helped the 5 times at night. Didn't stop the 6 to 8 times a day. They put the dog under general anesthesia and used their donors who are eating Hill's diet and have been on antibiotics, which they don't really have a really healthy microbiome. Okay, and the dog, nothing got better. It really didn't get better after 2 of them. And they basically gave up on the dog. They can't control the diarrhea. So the woman called me and she said, I'm investigating on my own. And I know you do the fecal transplant. And at this hospital, I gave them a lecture 9 years ago on fecal transplants. So they started doing them, but they're not doing them in a holistic way. They're doing them in a not a holistic way.
Yeah.
Anyway, I said to her, if I can get your dog's diarrhea to clear up, will you go all the way to the end with me and go to this hospital's administrator, go and talk about this stuff? She said, if you can stop, it's a miracle, and I will do anything you say. So we did all the holistic with the fecal transplant and the ozone and the UVBI. The next day, normal stools. 10 weeks of perfect normal stools in 1 day, okay? Which made me crazy that how could I not talk about this? So I waited 6 weeks to make sure it didn't slip through and gave the PowerPoint presentation to the hospital. Nobody will call me. They won't talk to me. They won't call me. They don't want me to know. They don't want to talk about it. And I'm insulted. I'm totally insulted that you would not want to be investigative and find out what happened. We tried for 9 months. We couldn't do anything. One day it's here, But this is an interesting piece because we're talking about flea products. I told the owner, do not use any chemical flea stuff on your dog. Your dog's microbiome is very delicate, and all it needs is a little thing and it's going to fall. And I gave her natural things. Well, she ended up with Hannah, come here. She ended up with ticks and decided to put Simparica Trio on her dog, right? The next day, 6 to 8 times diarrhea, 5 times at night. So we know that these products are deadly to fleas and ticks and parasites. What is it doing to the microbiome when you do it?
Oh, for sure.
You're killing it, right?
Sure.
So everyone's putting these flea products on their animals, and they're not correlating the animal's immune system to the loss of the microbiome from these pesticides that they're putting into the animal.
Yeah.
And it's really sad. I mean, this was clearly, dog was doing great, got that. 24 hours later is diarrhea again.
Yeah.
I had the dog come in the next day, and we treated it again with a fecal transplant and support, got the normal stools back. But that was clearly, an impact of these terrible chemicals that we think are safe for our animals because they're on TV and they're jumping around and you see these beautiful dogs happy, running around with these fake fleas flying all over the place. They are not healthy. In certain parts of the country, they are terrible, and we have to do something. But first,
Lily uses garlic, ginger, and turmeric.
Mhm.
How do you make that? Or Lily can't talk to us. I don't know how she combines that, but I just use garlic, and I never have a flea problem. So my dogs get garlic.
Yes, fleas and garlic work well, but ticks. I live in Massachusetts, and
yeah,
we have a lot of Lyme, and my dogs wear our amber collar, a raw amber collar. This company, woman who makes an amberstonepets.net, and she makes these beautiful amber collars, and they really do help. Also, I use the bug zone tags, and I use the flea free, which is from Green Hope Farms, and I've been using those for about 10 years now, and I still get ticks.
yeah.
But with standard poodles with curly hair, it's hard to find them, and I know I'm not finding all of them. I know it, because I'll see an engorged tick on the floor. But the people that are putting pesticides are still complaining that they find ticks dead, which means they were on the animal, they were sucking on the animal, they would have given them Lyme disease most likely, or Ehrlichia anaplasma, because they're saying that the Lyme spirochete can transfer within 4 hours, and it may take 12 hours for the tick to die. So the protection that we think we're getting from these diseases is not real.
It's not real. How hard is it to treat Lyme disease?
Well, we see Lyme disease here all the time, and I use ozone and ultraviolet light therapy with the hemolumin and do fecal transplants for them too as well, because many of these dogs have been on antibiotics when they come to me. And one course of antibiotics can knock your microbiome out for a whole year, and you may never get it back. So it's very important that we just don't keep putting antibiotics into the system unless we really, 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 really know what we're doing. Just lopping it with antibiotics is not the way veterinary medicine should be practicing anymore. The AVMA, the American Veterinary Medical Association, came out in August 2020 with an entire 250-page paper instructing the veterinarians to be judicious and have good stewardship with antibiotics. And it has changed in some of the practices. They don't throw antibiotics anymore right at something, but most of them are not doing that. They're throwing antibiotics at everything. And that is weak. The thing is, it really is sort of pushing it under the table, and something else pops up because you haven't really addressed the problem. And you have an infected toe, you put it on antibiotics, and then the dog has irritable bowel, and you go, oh, now we got to put on more antibiotics, and then it's got a chronic ear infection, and we got to put on more antibiotics, and then the dog gets cancer, and you go, what happened? Well, you just sabotaged the microbiome of the gut, and nobody's come back and replaced it and done a fecal transplant to give them their microbiome back. And that's why, I do the things with my dogs and have these dogs that we protect and keep them clean, and for 30 years without antibiotics and drugs and
so let's talk a little bit about Lyme disease while people are probably still coming in, but I think people are deathly afraid of Lyme disease, that if their dog gets Lyme disease, the dog's going to drop dead tomorrow. Can you explain a little bit about what it is and what they should be scared of and what they should be scared of, maybe the symptoms that their dog would show if their dog had Lyme? Because I think that's part of the problem. People are so scared that they go to the vet, and the vet just, here, this will protect you.
We've had Lyme here in Massachusetts for over 25 years, at least that. And in the beginning, we still see these dogs. We used to call it Lyme nephropathy that yellow labs would get, and they would all die. They would go into complete kidney failure. They were positive for Lyme, and they would die within days. And that was such a hard thing because my next door neighbor lost one, and another neighbor lost a dog. And, basically you put them on antibiotics and blood pressure medication, and you hope that they're going to have some effect of it. And most of the dogs don't. They eventually die. And they just go into complete kidney failure. So the kidney failure is the part that is the hardest. You can't unwind the kidney failure. It gets so damaging that you can't, dialysis in a person would be what they would do for that animal, but there's really not dialysis locations for dogs. And some of the places you can do that, but it's just a temporary thing, and then they go. So, how do you unwind that? And some of them I can't unwind. I know years ago, I just was like, the things that are causing me so much pain as a veterinarian is Lyme disease and cancer, and Lyme disease, the vaccines really don't protect the animals. So I still get clients that dogs get Lyme, but we don't see
with the
as
vaccine.
the Lyme vaccine. Yeah, I
So
don't think
they have the Lyme vaccine, but their dogs are still getting Lyme.
they're still getting Lyme. Yeah.
Okay.
So, how effective is the vaccine? It doesn't really help. I mean, I don't give the vaccine, and I just recommend keeping the animal's immune system stronger because, if the dog gets bitten by a tick and gets Lyme and you treat it with doxycycline, and again, they're just lopping doxycycline at it, they really don't know if that is going to be totally effective yet. And the way that they do the C6 is they test the dog with the C6. And if the C6 is over 30 and the dog has symptoms of Lyme, and the symptoms of Lyme, could be lameness, soreness in a joint, unable to stand, and the kidney issue. Those are the typical things that, they'd be running a fever, they can't walk, they're just sore all over. And then they put them on doxycycline. So doxycycline has an anti-inflammatory. It's very similar to an NSAID in that it produces a less inflammation. So often you put them on doxycycline, they feel better in 12 hours, and people think, oh, we got rid of the Lyme, we killed it with doxy. It's the anti-inflammatory effects of the doxycycline. What is doxycycline doing to the animal? It's killing the microbiome. But if that animal doesn't have a good microbiome, it's how much are you killing that's not really helping the animal that much anyway, right?
Right.
So I just don't know how people, why they don't do the alternatives, why they don't do ozone, UVBI. How they're treating people with Lyme disease successfully.
Yeah.
And we've been using it now for over 10 years with the UVBI, and now we have the Hemolumin, which is the UVA, UVC, amber, blue, green, and red light, and we use that plus ozone, and we do the microbiome restorative therapy. And the reason for the microbiome is I was getting into that is that I keep knocking on wood because I feel so grateful. My dogs have been positive for Lyme for 25 years, okay? And they haven't had symptoms. So what is in their immune system that's navigating this Lyme? And they're not being put with pesticides. They're not having glyphosate in the lawn. They're not having glyphosate in their food. So that glyphosate is Roundup, and that has a patent as an antibiotic for the intestinal tract. So most of the dog foods that we purchase are full of genetically modified corn and wheat and things like that have a lot of residual glyphosate in it. And so are we destroying the immune system of these animals by destroying their microbiome and not giving them a chance to protect their own immune system?
Right.
They've knocked out their microbiome. Yeah.
Right, because the tick doesn't want to kill off its host. It wants the host to survive, otherwise they die, right? So that's how nature works. So Lily brings up a good point from an article that she read from Dr. Will Faulkner. And it's interesting, Lily, that you bring that up. And by the way, hi, Jerry. I did a podcast with a wolf expert a few years back, and we talked about how do wolves die. I asked him, what's the number one reason wolves die? And by bar none, he said humans. We kill them. Like that's the number one reason they die. The second reason they die is that their teeth get worn down from eating the bones that they eat until they actually end up dying. And then thirdly, they get into fights and things happen in the wild. One thing he said they don't die from is cancer. And another thing he mentioned was that wolves are found because they track these wolves. And when they find these wolves, they're loaded in ticks. And yet none of them are dying from Lyme disease. So going back to the body being able to fight off what it's supposed to if we give it a chance, but we keep wanting everything quick and easy and, quick little, give it a pill once a month and everything will go away. And it ends up actually causing you more grief and more. And like, to your point, right? People don't realize.
They it's like I have an article that was, actually my mother just sent this to me and I just thought it was really,
yes, Lily.
It was an article that was written, and I got to get my time. I had my glasses in the other room, but it was an article that was written in the, this month in the Harvard Health Letter about the connection between the gut and the brain health. But it's sort of interesting, and also the whole immune system. And he talks about the whole, they're finally realizing they thought the microbes were things that they had to get rid of, right? And they were trying so hard to, they thought they were just hanging around and being opportunists in the gut. and they realize they are actually running the whole immune system. But it's interesting that, here, I've been doing this now almost 20 years, and this doctor from, saying we've just realized how valuable the microbiome is, and we're treating cancer and autoimmune disease and autism, and he just goes through this whole thing, and this is in the latest Harvard Health letter, right?
That's awesome.
And so it's really getting there, that there people are understanding we can't just destroy this innate ability for our immune system to protect the host.
Yeah.
And it wants to protect us. And you're going, I have a problem. And you're going, take this antibiotic and get rid of everything that can help you, right? It's just really crazy.
It's scary.
So, but yeah, I'm really pleased about, getting into mainstream Harvard newsletter, right? That they're talking about the microbiome.
They're going to have to, right? We can't just keep ignoring it. There's too much. People always want to say, "Oh, give me a study for that." Is there a study for that?
Exactly. And now there's so many studies. In 2000, there was one paper written on microbiome. In 2017, there were 7,123, and now there are probably 100,000 papers written.
Yeah, you can Google
so it. Explosive and such the new cutting edge of medicine, that it really is exciting to have been doing it first, and having our dogs be the ones that started the whole idea of doing fecal transplants on small animal. I mean, in large animal, we did it in vet school. We would give pigs poop, that had diarrhea, and we would do.
Thanks, Lori. Lori just put up the connect to the article.
Yeah, I could give her good. She got it, but I didn't leave it up there long enough. But she got it, and so the whole concept of understanding the immune system through the GI tract and through the mouth flora and the ear flora and all those things are just starting to be really appreciated, which is really cool.
So yeah, it is so cool. It is really, really so cool. What do you think about? Let's talk a little bit about studies. Mm-hmm. So I had a woman contact me back when I was involved in an organization that's trying to get some laws changed so that our animals aren't considered property anymore. And so they're looking at some different things and some vet malpractice situations and stuff. I'm not involved in the organization anymore, but this woman contacted me and she says, "Do you think this is veterinary malpractice?" That was her question. And then what she wanted to know was, she brought her dog to her veterinarian, her dog's vet that she's had for a long time. The vet said, "Hey, this drug company is doing a new study on a flea and tick product that will stay in your dog's body for 9 months."
God.
I know. "Do you want to be involved in this study?" And so she did, and she filled out all the paperwork and she did everything and she put her dog in this study. Well, the dog died a week later.
Oh my God.
He took it and the dog died a week later. And she wanted to know if it was veterinary malpractice. I didn't think it was, because
I think if she signed in to do something, a clinical trial.
I said, unfortunately,
I would never do that to an animal. Is give them something that would make them a no pest strip for 9 months and be killing. Oh God.
But what is so interesting to me in that, and how I know studies work, that dog is just going to get removed from that study.
Oh, absolutely. Oh, it died from something else.
Yeah, they're not going to
die from something that it's really sad, because sadly, double-blinded studies are not always blinded. They can remove things and be blinded. That maybe that they're blinded from those parts of the study, and that's what they only publish, the things that they actually want to see, not the stuff that actually is there.
And I don't think people realize that.
Yeah. And you want to be honest with people. You want, I tell people I don't have clinical trials on my microbiome, but we've done 20,000 of them, from all the vets that use our microbiome. And it's like the things that we see, the miracles that I see are like blow my mind. I mean, they blow, and any of you that are vets out there that are hearing this, to have these additional tools in your pocket to help patients is what you want. You want to be able to tell somebody, there's nothing we can do. I mean, I want to tell them that there's nothing I can do. Have you tried this? Have you tried this? Have you tried this? Have you tried that? And they don't even know to even ask that question. Have I tried this?
Yeah.
So it's really important for, anyone out here that's watching, and any vet that's out there that is watching this, that there are so many wonderful things that are available for people to study, and getting involved in like the American Holistic Veterinary Medical Association or the Chi Institute or IVIS or the Veterinary Botanical Association or the acupuncture, homeopathy groups. It's just there's another way to look at something, and they need to all be filtered through your brain and say, I can't do this, but I think acupuncture might help your dog.
Yeah.
And I can't do this. And I had another case that was, I mean, that's not related to this pesticide, but I'm very sorry for your friend's loss. I think it's so sad that the veterinarian, who probably was majorly educated by the drug company, was convinced by the drug company that this is a safe product that will prevent fleas and ticks for 9 months.
Yeah.
I think that she should report it to adverse reactions. I would contact the company and I would tell you it's an adverse reaction. I would write to, wherever you can, and put that name of that product and declare it killed your dog, and unless the veterinarian said, oh no, it got hit by a car and it died. Well, otherwise, if it just died from some serious medical condition, we need to document what that dog died from, so that we can show in numbers. And that's where, people are starting to understand that these drugs that they're giving, whether, the Bravecto and the Simparica Trio and all of these things that are heavy pesticides that are killing these insects and killing these arachnids and all these other, things that are anything that's, jumping on the animals, is destroying their gut, is destroying it. And that's 80% of their immune system. So, they think that they're keeping these animals safe, and they're putting them into, life-threatening situations.
It's awful.
Yeah.
Lily has a question. We're going to shift gears here a little bit. This is a great question, Lily. What are your thoughts on annual blood work for your dogs? She says checking for heartworm yearly. I just started keeping a symptom log for my dogs.
Well, in Massachusetts, we check yearly for heartworm. We do the 4DX, which is the Ehrlichia, Anaplasma, and Lyme. And I'm sure there's a lot of other tick-borne diseases we don't even know how to test for yet, and because we're testing for 4 things. I think heartworm is something that we do see up here. I don't know where Lily lives, but in Florida and Virginia and Texas and in the Midwest and Missouri, they're having a lot of heartworm. And it's because climate change is happening and mosquitoes are moving further north. We've always had heartworm up here, but it hasn't been that serious. So many of my clients aren't taking heartworm preventative. I give a limited amount of heartworm because we know that the heartworm is an antibiotic, and it does kill the microbiome once a month. And so I don't want to kill the microbiome once a month on my dogs. So what I do is I do a fecal on them, and then I save their fecal and I give them a portion of their pill, because the Interceptor can have a little less not to kill the gut flora. And then I feed them back their microbiome. Like I feed them their poop back 24 hours later, so that the ivermectin has cleared and I haven't hopefully destroyed species that I want to preserve to share with other people.
So Lily's in Virginia. I know we don't have heartworm here in Southern California. I just, some people will argue that's because all the dogs are on heartworm medication, but my dogs aren't. And I just refuse to give them.
I think you, if I had to rate what I see the most, it's cancer.
Yeah, me too.
I think I've had a case of heartworm 3 years ago, 1 case.
Yeah.
Right?
Yeah.
Before that, maybe 2 years ago, So if you have to, look at the elephant in the room or the gorilla in the room,
Cancer.
What's the gorilla? It's cancer.
Cancer.
And then, and a few years ago, to me, it was Lyme was just everywhere. A lot of people are keeping their animals' immune system stronger and doing stuff, and they're finding, that I think is really helping a lot. But the heartworm is not the big problem. Distemper is not the big problem. Parvo is not the big problem. The big elephant in the room is cancer. And if 64% of golden retrievers are getting cancer, that's a problem. Not 64% of the dogs are getting distemper.
Right.
64% of the dogs are getting heartworm. No, or maybe in Florida if they're not on heartworm preventative. But the big problem is this autoimmune collapse and getting cancer.
So if you live in an area that, I know there's a vet here actually that recommends this to his clients, and I'm so thankful. But we're in Southern California, so I think it's really, really safe. And to be honest, heartworm isn't. I've done all my research that I can do that I'm comfortable not giving it to my dogs, but I'm not in an area where we have a lot of heartworm or Lyme disease for that matter. But this particular vet says, I'm not going to give your dog heartworm medication. I just want to test your dog for heartworm every 6 months. That's what he does. Do you think that that's a good?
Well, there's so many now. The heartworm are resistant to the drugs. Okay, so even treating them they're resistant. So there's a whole resistance now. They think that there's an additional parasite that gets into the blood cells that needs to be killed before you can even treat the heartworm. So they put them on doxycycline for, I think, I haven't done this protocol, but for a month or so, and then they try to kill the heartworm. And I use the ozone and the UVBI, and we use ivermectin post, to kill. And I've had the 1 or 2 cases that I've had and I add herbs to it too.
Yeah.
And then we do a fecal transplant, and so we're supporting them. We're killing stuff, and then we're lifting them, and they're killing stuff and then lifting them, so that we're hopefully getting underneath the immune system, so that they don't get so weakened by, a month worth of doxycycline to chase after this one parasite.
Yeah. Would you recommend though doing that, like running the blood test? Well, how often would you, if you were going to try to do that?
I would do it twice a year. Then, if you live in a southern state, the chances of you getting heartworm are real. Okay, so doing stuff that deflects ticks and fleas and mosquitoes in a natural way would be my choice. Not taking your dog out during twilight or in the early morning when the mosquitoes are the peak. Those kind of preventative kind of things, spraying with cedarwood oil, repellents and things like that are natural. If you're not going to go that direction. But, when I lived in Florida, and I grew up in Florida, and I went to the University of Florida, the heartworm was killing dogs all the time. We would open up the heart of a dog, and it was like it was stuffed with spaghetti, and just full of worms migrating. I mean, they were just the whole heart. You opened it up, and it was like, somebody took a heart and just packed as much spaghetti into the heart, and hundreds of these worms. And I haven't seen a case like that. The last case that I saw that was like that was actually a wolf. That was a hybrid, that was a pet. And it had gotten heartworm, and its whole heart was filled with, parasites. But that's been 25, 30 years now.
Yeah.
But that dog, it was so filled, and it dropped dead. We were trying to figure out what happened to it, and opened its heart. It was full of parasites. So, whether it was full of parasites because it was a domesticated dog and was given commercial dog food because it wasn't a wild wolf.
Right. I definitely think that, diet plays such a huge role in letting the body do what it's supposed to do and eat. That's why I did the podcast with the wolf expert, because I had heard so many people were saying wolves this and wolves that, and these are domesticated animals, and you have all these arguments and what a wolf eats and what a wolf doesn't eat, and it just went on. And I said, well, let's just talk to the wolf expert and see what wolves actually eat and go from there, because so many people think that wolves don't eat any vegetation, and they don't eat any berries, and they don't eat any of that stuff. And reality is, according to the wolf expert, they eat a lot of it. Actually,
they do. They graze. My dogs graze, like now with all the spring grasses coming up. They graze all the little buds, and all the little grasses coming up, and they'll all be out there, look like little goats, grazing in the grass. And then when the blueberries come out, we have lots of blueberry bushes all over around here, and they're like little bears pulling. They pull them off, and they're like running into the bushes. You can't, so excited when they find a bush that has a lot of them that they can get them all at once.
I have a mulberry bush and mulberry tree in my backyard, and my dogs too. They wait for it, and they know, and then these fall off. It's a big tree that kind of, and they just hang out underneath it. It's like a big umbrella, and they just like wait, rattle the bush, and then they fall off. They figured it out.
Oh, that's good.
Yeah. Good. So, to think that nature's provided what our animals need in order to protect their microbiome and keep them healthy and to ward off disease. And then we come along and we're like, no, we're going to live in our pristine, clean house.
Right. That's why with this article about, we thought they were opportunists, and now they are, this article from Harvard. That's what he says, we had the wrong idea about this whole gut and why we have to think we have to destroy it.
Yeah.
So it's neat that, it's getting into mainstream medicine. Yeah.
Yeah. It's letting people understand, like what you were saying, that the flea and tick stuff isn't even, it's not going to prevent you from getting Lyme, because the tick has to still bite. Right. And getting people to understand different mindset, because right now you just go to the vet and every vet gives the same protocol. Right.
Well, when you go to veterinary conferences, the veterinary conferences is underwritten by the drug companies. So when I go to the big veterinary conferences and I get to see, good lectures and all that, and you go into the exhibit hall and you see, Merck and Pfizer and all these big companies, with booths that are giving away, stuffed animals and, free prescriptions to this or a ticket to this theater, or, they're, and then they do a whole presentation. They have a dinner and a event and a whole movie and a special, comedian or, celebrity band or whatever. And it's wonderful. It's fun to participate in all that, but I don't buy their products. I'm like, they're paying probably, $200 for me to go to this dinner. And of course, I'm not buying their stuff, but other people feel like, wow, this is the core of our veterinary, business model. And
Right.
I can't swallow it because I won't take that stuff and put it on my own personal dogs.
Well, because they also show you all the studies, right? But like I told you, this particular woman, I guarantee that dog is not going to be they are not going to talk about that dog in that study at
Oh,
all.
no. They'll say, they may not even list it as a death.
It won't even got brought up.
If it had diarrhea before, they may say it got diarrhea, but it died, but they won't say that.
Yeah. Well, the vet herself, and to be honest, I feel sorry for some of these vets, especially the younger ones who are coming out. They love your animals. Like, I can't stress that enough.
I agree. And our profession is wonderful.
Yeah.
We have a profession that has always been honored, and the vets and the people that go through veterinary school, most of them, I would say most of them aren't going to vet school because they want to make money and make a lot of money. They don't make, I mean, if you want to do that, you need to do a startup or something like that.
Yeah.
But but to people that they put their life, they have to compete so hard to get into vet school. It's very competitive. And when I applied, it was 1 out of 300 applicants got into vet school, and if it was a woman, it was 1 out of 600.
Wow.
So it was very, very, very hard to get in, and you felt so privileged to be able to go to vet school. But when you get into vet school now, so many of them are completely corporatized. They're funded by the dog food companies. They're funded by the drug companies. They're beholden to them, and you can't have freedom of speech. And that's the part that I find very, very disheartening, that the students are not getting in the whole story. They're getting what the drug companies and the dog food companies are educating them with.
Right.
Really sad to me.
It's awful, because who is going to pay a lot of money, work their butt off to get into school? Like you're saying, it's still difficult to this day to get into vet school. You're not exactly going to sit through 4 years of vet school and then come out and say, well, everything I learned there was BS. You're at that point.
No, and now you've swallowed the Kool-Aid, I guess they could say.
I hate to say it, but they really do believe it. I don't think there's a vet out there that's saying, here, take this flea and tick stuff because I want to make some money. They really do believe.
No, they get the lectures on the tapeworms and that the fleas give you, and the tick diseases and all that, but they don't realize that they still get it.
Yeah.
They keep getting dewormed. And so how do you get the immune system to say, I'll take care of, I'll take care of the body if you take care of me?
Yeah.
Instead of, let's just kill everything off and hopefully the animal survives around it. And there are so many vets that if they had these tools, their lives would be so much more fulfilled.
So much more
fulfilled. And they, to have veterinarians having to have compassion fatigue, which is what's happening to vets now. Everyone's exhausted. I can't find, if anyone out there knows any vet who wants to come work for me, and work with me, not for me, but with me, and in a holistic practice, please send them my way. I can't find a vet to work with me. They've either, just say, I can't do it. It's too much stress, because it's so stressful during COVID. We have to have so many more layers because of the, bringing them in and not having room, and and having being masked. And of course I'm double masked in that I wear a whole headgear because I have a injury from veterinary school that paralyzed my diaphragm, and so I have to be very, very careful. And so but I can't, I'm 69 years old, so I can't be doing 70 hours a week anymore. So I need help. Anyone out there, please, 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 I'll
I
hold to you forever if you find me a vet.
Well, maybe I'm not a vet, but maybe I'll come out and work with you for a couple of weeks, help out as much I
Oh,
can.
you're sweet. You're sweet.
I have been working on, so anywhere between 25 and 30 people work for me at any given time. So, and I get young people who are wanting to go to vet school, and boy,
Right.
I am like, give me you first. Like give me you first before you go to vet school, so I can maybe have you go into vet school with an open mind, and because I feel like that's where we really need to go. We really need to get.
No, we need to get, and that I totally agree with you. And that's where, I try to lecture to vet schools through the American Holistic Veterinary Medical Association. And we can now, with online Zooming, I can go anywhere. I used to travel to the different schools and lecture, and even in India, I lectured, and I recently lectured in Romania, but I didn't leave my house. I lectured virtually, and I can do that. And it makes it really wonderful to be able to share, the years and years and years of studying with people that I think are just amazing, and learning from them and teasing out what I can teach others. But still, the veterinarians they're exhausted. They all have so many student loans. Veterinary school's gotten so expensive that they can't take off a 6 months and study acupuncture intensely, or take off a year or two and do other modalities. And that's where, if I hire somebody, I want them to know those opportunities are there, and learn this stuff, because it's so nice to be able to have another way to do something versus euthanasia. And when you have to euthanize everything, you really get like, it's just depressing.
And treat the same ear infection over and over and over, right? Like eventually you just go, this is my job. This is what I do.
Right. I mean, it gets boring. I mean, it's like
boring.
Doing integrative medicine is so exciting.
Yeah.
I mean, it's exhausting, but it's exciting. And I mean, I can give you some cases that are just this recent cases I saw this weekend. But this dog, it was diagnosed. He was hit by a car in beginning of January, end of December, and had a fractured back. And they said to put the dog to sleep. It was only a 14-month Rottie, but they don't think they'll ever get bladder tone or anal tone back. It's lost so much of the parasympathetic system. And so she's a nurse, and she really wanted this dog to try to do everything she could, because it was a young dog. It was just still a puppy. And so she had the back surgery, and the dog was had a diaper. It had incontinent. It was on Uriclin for parasympathetic mimetic. It had no anal. It had some anal tone, but had liquid diarrhea for 2 months. So the base of its tail was excoriated from the diarrhea. So it was on pain meds. It was on antibiotics. It was on chloramphenicol, which is an antibiotic that has been taken off the market. But that was the only thing that bladder was, the urine was sensitive to. And so they told the owner not to wear gloves, and when she gave it to the dog. But this dog was leaking urine and had liquid stools all over the place. Okay. And so it came in, and the dog could walk about 25 feet. Okay. So it came in, and I said, well, let me do ozone. Let me do aquapuncture. When I put the needles through the back, I felt like I was going through beef jerky instead of muscle. It was just, I had like almost screw my acupuncture into the dog. And we did ozone, we did UVBI. I flushed the bladder, took it off the antibiotics, flushed the bladder with ozone a bunch of times, and started the dog on support, with gut support and everything. That was day 1. And it came back day 3, did it again. Day 4, it actually could wag its tail. Hasn't wagged its tail since the accident, right? Tail was wagging. That was day 4. Day 5, did it again with a fecal transplant. And the next day, he could control his stools, had a normal stool, and started to urinate on his own.
That's amazing. See?
So, and then he walked 2 miles.
Yeah.
So he was off all their drugs, off all their pain meds, and this is a university, off all that stuff. And within 6 days, this dog was walking, peeing, and pooping on its own, and the bladder didn't smell like dead fish. Okay.
That's a bonus.
That's right. So, I mean, this dog, but was really challenging. And this is something that I think everybody should hear and spread the word. This dog was on chloramphenicol. The owner was told to wear gloves. She was never told that this urine would have chloramphenicol in it, right? And of course, this dog is leaking urine and leaking poop, which it would have the chloramphenicol in the poop too.
Right.
Nobody said you got to treat this like it's a toxic waste dump, right? Her 3-year-old son stepped in it and had head to body rash and was in the ER for 2 days.
Oh my God.
So we know that this antibiotic is shed in the urine. That's why you're treating the urine, right?
Yeah.
And where is that urine going? It's going into our soil and killing the microbiome of our soil. And it didn't work. The dog was on it for 6
It didn't work.
It didn't work. It still was positive for this bacteria.
Yeah, that's the thing.
It's just, to me, they're but the point of it is that anyone who's ever uses an antibiotic, knowing that the antibiotic is shed out the urine and the feces, they have to be very careful. And chloramphenicol is one that is very dangerous.
Sounds like it. Wear gloves.
Yeah.
So we know just from, just having this conversation that the problem isn't the veterinarians. The problem is the veterinarian schools, right? It's the schools, what the schools are teaching these vets, and the vets are coming out feeling empowered. Is there any veterinarian schools at least in the United States, that's where most of the people are listening, that we can feel a little bit more confident about, or that you know of?
Washington State has an integrative program. Tennessee has integrated. Louisiana does. Cornell has had some too. Tufts does not at all.
Yeah.
I'm very disappointed in them that they don't embrace all this ability. And I was on faculty there for 8 years and taught acupuncture after hours. They told me I couldn't do it, but I would take the students aside and give them acupuncture points and things like that.
Yeah.
And I feel sad for universities that aren't offering this to their students to give them other opportunities.
Yeah.
And the Chi Institute, which is, based in Florida, has educated thousands of veterinarians around the world. They are just wonderful and have courses online and courses there. And they have a campus, or they have teaching in Europe and China. And so they've got it going all over the place. And then IVIS, which is the International Veterinary Acupuncture Society, is what I got trained in 1975. And I was the first woman to take the acupuncture course ever. So I was, really lucky to be getting into this stuff very early in my life.
Yeah.
It just lifted a veil and said, here's opportunity. Why don't you learn more? And then I kept studying. The more I knew nothing. And I know less than I did when I started.
Well, it's so interesting. That's what education does. Like, if people are open to continually learning, I think that's part of the problem too. Vets go to vet school, they get their white coat, and then they're like, I'm a doctor. And then I stop learning for some reason. I don't understand that.
I think most of them want to keep learning, but it's overwhelming. I mean, your life is so, you don't have a life when you're a veterinarian. Yeah. You're constantly on call if you are like, if you're in a corporate situation and everybody has their 4 hours that they work or their 10 hours that they work, they know that they're checking out at that point, right? Yeah. But most veterinarians that have grown up as having your own practice and being there for your clients, you're exhausted.
Yeah.
You're totally exhausted. So I think, there has to be a way to balance that out with everybody so that everyone realizes that the veterinarian can't be on call for your dog 24/7. And that's why when we developed emergency clinics, but sadly, the emergency clinics don't respect what I do. They'll immediately put them on, metronidazole and they have diarrhea or something, instead of saying, okay, let me call her, find out what she wants us to do, because I know she doesn't want to disrupt the microbiome.
Yeah.
But they just throw them on, if they have diarrhea, they go on metronidazole. If they're vomiting, they go on Cerenia. They don't think about what herbs I can use or what ways we can do to not kill the microbiome off.
It's hard too. I just had So I took on this dog. Long story, I won't bore anybody with, but years ago I took on this dog because he was having seizures and the owner wanted to put him to sleep. I said, no, give him to me. And so I took him. Had him for years. He's seizure free, medication free for years.
Mhm.
I hired a new girl. She fell in love with him. She says, please let me take him home and let him live in my home. And so we actually let her do it. He got sick. She panicked, didn't even call me, took him straight to the vet. She
Mhm.
thought he had bloat. He's only a little tiny dog. She thought he had bloat and he was dying. And so she freaked out, takes him to this vet, calls me after the fact. So,
Mhm.
which I'm angry about because she calls me after the fact. The dog's fine. I said I would pay the bill because I always told her since I had taken on this dog
Mhm.
financially, I will continue the financial responsibility for this dog, but you can take him home.
Okay.
So that was our deal. So she takes him to the vet. And then I go to pay the bill, and the receptionist is reading the bill to me, and she says, well, we did an x-ray and it looks like he had a lot of food in his stomach. So then
Mhm.
we did IV fluids all day. Mind you, this was one day of him not feeling so great. And so
Mhm.
we did IV fluids, and then we're going to give him Serenia. We already gave him a Serenia shot, and we're going
Mhm.
to send him home with more. And I said, yeah, take the Serenia off.
Mhm.
I'm not giving him that.
Mhm.
She was livid. The way that this woman handled me declining to take that drug home was shocking and made me think, no wonder people just do whatever they say because they're just kind of
Well,
bullies.
right. Well, no, it is. I think the veterinarian believes it because they don't know another tool.
Yeah.
It's not like they're trying to push something on someone. They don't know there's something else to do.
Yeah.
If you have a hammer and everything's a nail, if
Yeah.
you have a vice grip and a level and a screwdriver and you have all these other tools that you could do, but if you only know how to hit a hammer on a nail, that is all you're going to be able to do. And you keep whacking it, and you could do something much more indirectly and get it better, or you're just going to keep doing this to it. And I think that's one of the things I wish that the veterinary schools could incorporate these other alternatives because people want it. It's why do so many gravitate to Whole Foods? I
Yeah.
mean, you can just eat things that aren't healthy. I mean, people want to be healthier.
Yeah.
They want to eat healthier. They're conscious of it, and they want the same thing for their dogs. And and thank goodness there are companies that are coming out with whole food diets and fresh food and frozen food that you can pick up, and it's not all heavily processed. And now we need, more plant-based diets, which is what I feed my dogs. It's a lot of work,
Yeah.
but we need to be doing less animal protein because it's the impact on our earth is so severe.
Yeah.
And I think I've talked about this before because I always sort of channel into that because my training is to be helping animals. And if you take one 70-pound dog and for 11 years you feed them a meat-based diet, what's the impact on our earth for the meat only? It's 8 million gallons of water. This is on our earth. 8 million gallons of water, 180 tons of grain, 365,000 miles worth of petroleum to feed that animal. And then once it's killed, take it to the slaughterhouse and the packing houses and the processing plant. Um, then it's 5.5 acres of rainforest that has to be cut down to raise genetically modified corn, soy, and wheat to feed the cows and the pigs and the chickens that are producing tons of feces, methane, and CO2. I can't even remember the numbers in that. But the worst part is I'm going to tell that client with a new golden retriever puppy that wants to feed a meat-based diet to kill 8,127 animals for one dog. It's not fair. It's wrong. And I can no longer, support that kind of thought process that my dog is so much more important than 8,127 animals.
Yeah.
So we have to be much more climate change is real. I mean, I believe in climate change, and animal agriculture causes more pollution than our cars, than our planes, than anything. So if we can all do our part and give our animals and have these and pressure companies to make organic plant-based dog foods and cat foods that can be utilized in an efficient way. And there are companies that are out there, whether it be, doing fabricated meat or doing, a lot of plant-based, proteins and stuff. And they are. There's none out there right now that I really love, and I keep hoping they're going to follow some of the concepts that I have, because I don't want to damage the microbiome. If
Yeah.
they're using genetically modified, garbanzo beans, and they're using genetically modified lentils, that is killing the microbiome. So
Yeah.
we don't want to do that. But everybody eats that. That's the standard food that everyone eats, is full of glyphosate, and that's damaging the microbiome. So, that's why I make my own food, and it's a lot of work. And anyone who wants to help me make my own food, I appreciate it, because it really is, it's very challenging. But when I finish making my food, and it's taken me 12 or 15 hours, I look at it and say, I just saved between 7 and 10 animals' lives by making my food for my dogs. And as I'm exhausted, and then I go, I couldn't do that in 17 animals at 17 hours or 15 hours at my clinic. I don't save that many animals. I mean, I help them, but I don't literally prevent them from dying.
Yeah.
So
I agree with you 100%. I've looked into some vegetarian diets for dogs, and they're just awful. They're just awful. And so we need some commercial diets. So when we talk about like a vegan diet for your dogs, be careful, because there are some things that you need to learn a little bit more. I know Dr. Richard Picarin and his wife came out with a book that has some recipes in it. We've had Dr. Picarin on the show. He's going to be coming back. So
right.
don't just go out. What Dr. Roman is telling you is true, but I don't want you to just go out and go, okay, now I don't have to feed any meat. There is some stuff you need to know.
You really need to, know, you need to be balancing it. And, I on my website, I have what I made a video, like, a few years ago, that what I feed my dogs. I've tweaked it, and I need to remake it.
Yeah.
But it's a lot of fresh vegetables and fresh fruits, and I grind them all in a Cuisinart, so it could be like 7 or 8 different vegetables.
Yeah.
And 5 or 6 different fruits. And then I soak the beans to get rid of the lectins. And then I cook them really well. And I use quinoa and oats. And so it's my dogs would way better eating their raw venison than
How
they
many
would.
dogs do you have?
Right now I have 7, which is way too many, but because of the microbiome, we have such a demand for the microbiome. I'm afraid to let anyone else leave.
Yeah.
I have 3 of the puppies left, and they are amazing. And I'm if somebody wanted one to be doing the microbiome, I might part with somebody, but I just love them all. They're all so sweet, and that's what we're trying to give to these other dogs, is the mental component.
I want one of your dogs so bad. If I had a bigger, so the Spaw is big, but we only take little dogs in there, because if you put too many big dogs in there, it's not big enough. But I've always had a house dog. Bo, the one I was just talking about, was our house dog for a long time. And there's somebody there 24 hours a day. It's a really good life, actually, for a dog. But my home, I have my golden retriever, my 3 cats, and my little dog, and 4 turtles and whatever. So I can't take one of your dogs, but I would love to partner with you someday on that, because I would really, really like to be involved in having a dog with an amazing microbiome that I can help with the veterinarians around here. I do have one vet, and then Dr. Katie Kangas is down in San Diego with Dr. Barry Sands. I know they would absolutely love to have poop.
Right. No. So, I mean, like, Audra McCorkle, Audra she has one of my puppies.
She's up in LA, right?
She's in LA. So they can get live transfers on the West Coast now in 2 locations.
Yeah.
In Los Angeles with Audra McCorkle. And then Terry Sue Wright has she doesn't have one of my puppies, but Karen McCarter has one in Oregon. And so she's supporting that clinic and other clinics around with live microbiome from one of my puppies.
Have you ever cross species poop?
Yes.
Because I'm just wondering, so it would be okay to take the fecal from a dog to give to a cat?
And I've done it multiple times. It happens all the time the other way around. I mean, dogs always eat cat shit, right?
I confess for that.
Right. Everybody knows that. They're trying to keep their dogs out of their cat litter boxes.
Yeah.
So I've done it. I've done several of them, and I had no problem whatsoever.
No problems.
Yeah. And even Trapper, my donor, when I got him at like 10 weeks or 11 weeks old, I gave him my dog's poop for days. I just kept pollen poop down his mouth because I wanted him to get a diverse microbiome because he
Yeah.
wasn't from a breeder that I felt was, I mean, he's already 10 or so. So he's been with us a long time, and but his microbiome is saving cats' lives. It's amazing.
Yeah.
So whether he got inoculated and he's producing more dog, and he sleeps with the dogs, and he hikes with the dogs, and he hangs with the dogs. And then I have another cat that was raised. She was 30 years of feeding raw food and not vaccinated cat. A Siamese. And so she's my cat donor. I mean, the two of them together because I can never tell whose is whose in the litter box.
Yeah.
So we used to, just do trapper. Now we just call it cat.
Well, I have 3 kittens right now who've never eaten anything except raw food, raw organic food, because I got them as bottle babies. The only bummer part is that they came from the animal shelter who insisted on all the vaccines.
Right.
And
so they probably don't have a diverse microbiome.
Yeah.
They don't. And you need to give them the diverse microbiome and then nurture that.
Yeah.
Because if you don't have the species there, the food is probably not going to generate those species.
Yeah, I should have you. I mean, I have been giving them. They get tripe a lot. They get some things.
Good.
I'm trying to keep it, but I should probably get some poop.
Right. You should get some more cats.
Yeah, I should get some. I should look into it because I just want them. I know the oldest living cat in the world was 38 years old, and so yeah. So
the oldest cat that I've taken care of was 25.
Yeah. Well, this was Cream Puff. I don't know about in Texas. The guy,
that's wonderful.
Yeah, the guy had it actually made it into the Guinness Book World Records, and you know how strict they are about. So literally, the cat was 38, and then he had her sister. Her sister was just right below that, like 37 or something.
That's amazing.
But the guy says that he only fed them canned tuna and asparagus their whole life.
Wow.
Okay.
Well, I mean, asparagus is high in glutathione, so maybe asparagus.
He swears that is all he fed them was canned tuna and asparagus their whole life. You can look her up. Her name's Cream Puff. There's a whole story. Okay. Cream Puff. There's a whole story on her. So anyway, back to my cat. So my husband decides we're going to adopt these 3 kittens that I foster failed on. And I said, if I get my way, these cats are going to be 38 years old. I'm 53 and you're 57. So
so are you feeding them tuna fish and
no, I trust me. I kind of thought about it. I'm like, is this guy got something? Because both his cats. So I'm like,
that's amazing. I mean, there are stuff, like the dog that, Bramble, the dog, not Bramble, but the one in Australia that lived to.
Oh, Maggie.
She ate placentas all the time.
Yeah, she was
eating placenta. They didn't give her food. She just went out during the lambing season or and got the placentas in the field.
Yeah, it was amazing. She's 29 years old, and
she
was a big dog. She was a big dog.
Yeah.
So
we don't know. I know for sure we are not having longevity in animals like I did when I first graduated.
Yeah.
There are not these animals that are living to 25 or dogs that are living to 19. Nope. It's a rare thing to find that happening, and it's more common that they get cancer at 7 and they die. I mean, that is just so outrageous to me. It's just outrageous.
Yeah, it should sparks the anger in me. It's why I'm going to keep using my voice and talking to veterinarians like yourself that are helping to kind of push this movement and get people to start rethinking what they're thinking. You have to be your pet's advocate. So we're going to wrap this up because it's 5:07 and I kept you. Thank you so much. I'm
sorry I was late. I had it. I remembered this morning. I was like,
no, you're fine. I want our listeners to know that we send out a calendar to all of the vets that I recommend. And they sign up on their own. Like I don't have to beg them. I don't have to call, please. They sign up for this for free to come on and answer your questions and be here because they care so much about your animals. So if you're going to use a consultation from somebody, I really encourage you to use the vets that I recommend, because they are fabulous and they will make a difference in your life. So in your pet's life. So reach out. Lori has written everything she can, so you can get a hold of Dr. Roman at MASH Vet. You can
Yeah,
contact
so
her.
I like, I really like to see the animals, or, we can do a virtual, and I want to include your vet. So if you have a vet that has an open mind, that is willing to do more for your animal, I want to include them. I'd love to move their thoughts and their mind to a more open way of doing it, because if they find success with your animal, then maybe they'll do the next one and think of it right away, versus waiting for the person to spend 9 months treating diarrhea and then, find a way to help that animal not have diarrhea in one night.
Yeah. Yeah. I think that you make such a good point. For those of you who are listening, that is amazing, because to have a veterinarian who's saying, look, I don't want to just help your animal. I want to help your vet help more animals. And that's what Dr. Roman's saying, is that you wanting to help your pet, working with Dr. Roman could just have a snowball effect that could make such a difference in every animal's life. And that's why I love you so much, because it isn't about the one animal, it's about all the animals. And you're just a blessing to have on this show and have in my life. And I just enjoy you so much. Thank you.
You're welcome. Yeah. And I would have loved to come out and be live with you again. It was so much fun before COVID, to do these things.
We're gonna do it when things start to we'll get you back out here. I told you were, I think, my very first veterinarian that I put on back when I first started the podcast. She flew all the way out here from Massachusetts to come to my little studio I had in LA. Just amazing to have that much passion to help other people, right? And help these animals. You're just a blessing. So thank you. And I can't wait to see your name on here. I do it every Wednesday. So I'm just, Lori keeps sending them out, and we just keep on going until we see these animals living to be like Cream Puff and Maggie. So,
right. And the same thing, we have to have the same thing happen in our own bodies and our family bodies.
Absolutely.
All the same things that your animal is getting, you have to pay attention, because they're the little canaries in our coal mine. And they are exhibiting what you are getting exposed to. So if you're getting exposed to the contaminated water and the contaminated chemicals in your house and lawn and everything else, they love us so much that they are saying, look, I got cancer, and don't do this to you, because I love you.
Yeah.
And it really is that. There's unconditional love that goes beyond just their attentiveness to you. It's beyond.
We are going to end on the unconditional love that goes beyond. What you just said was amazing. I'm going to end on that. So have a good evening. Lori, thank you so much for getting all of this information out there so everybody can get a hold of Dr. Roman. I think it's really important for them to do that. Dr. Roman, I will see you later. Have a good evening.
Thank you, Carrie. Take care. Be safe.
Bye-bye.